How's it going, guys? We have a past level question of hepatobiliary steps 1 and 2. 50-year-old man, he's got a 1-hour history of severe abdominal pain, history of alcoholic cirrhosis, was treated for spontaneous bacterial peritonitis last year. Trucio-chavostic signs for hypocalcemia are positive. Trucio sign, inflation of blood pressure cuff, causes carpal pedal spasm. Chavostic is spasm of the masseter. Serum alkaline phosphatase normal at 120 should be 50 to 150. What's the most likely diagnosis? Choice A, cholangitis, wrong fucking answer. So our ALP would be increased in cholangitis because we have inflammation. Cholangitis means inflammation of the bile ducts, okay? And then you'd also have Charcot triad for cholangitis, which is abdominal pain, fever, and jaundice. Textbook will say right upper quadrant pain, fever, and jaundice. I can tell you NBME questions. They'll just say abdo pain, fever, and jaundice. There's no fever here. There's no jaundice. ALP is normal. Cholangitis can obviously be spontaneous, bacterial, just ascending cholangitis, that's bacterial, or it can be primary sclerosing cholangitis, part of IBD, usually UC. Wrong fucking answer. Choice B, cholecystitis, wrong fucking answer. So this just means stones inside the gallbladder. So cholelithiasis plus fever, we call that cholecystitis. So fat 40s female fertile demographic for cholesterol stones. Pigment stones would be increased RBC turnover, hereditary spherocytosis, sickle cell, and no fever here once again. You'd also have pain associated with it. So not the best answer, but you're going to do ultrasound followed by HIDA scan to diagnose. Cholangitis, they want ultrasound, and they also want ERCP, I've seen as an answer on one of the 2CK forms for diagnosis. Choice B, wrong fucking answer. Choice C, gallstone pancreatitis, wrong fucking answer. And you know it's wrong because our ALP is not elevated. So this is a form of choledocholithiasis, which means stone in the biliary tree. We said cholelithiasis, stone in the gallbladder. So choledocholithiasis, when the stone has descended distally enough in the common bile duct where it's blocked off the hepatopancreatic ampulla, we call it causing obstruction of the pancreatic secretions. We call that gallstone pancreatitis. Question would tell us ALP would be increased. Okay, so direct bilirubin, ALP would be increased because we still have a common bile duct obstruction. On the NBME exam, and I'll just elucidate this further, they want hepatopancreatic ampulla over common bile duct as the answer for the location of the stone, but we still have a blockage of the common bile duct where ALP and direct bilirubin would be increased. Wrong fucking answer. Choice D versus E, OMG. Is it acute versus chronic pancreatitis? It's acute pancreatitis. Choice D is correct because we have severe abdo pain. Doesn't have to radiate to the back. Okay, just abdo pain and an alcoholic, and we have hypocalcemia. Okay, I've harped on this in my PDFs, prior clips, that hypocalcemia and hyperglycemia are the two highest yield negative prognostic indicators, pancreatitis, acute pancreatitis on USMLE, okay? You don't have to memorize, if you're doing 2CK step 3, you don't have to memorize all the Ranson criteria. You just need to know high glucose and low calcium are really important, poor prognostic indicators, and that the degree of elevation of amylase/lipase does not correlate with prognosis, okay? And the question doesn't have to tell you the amylase/lipase levels here. It's obvious that it's acute pancreatitis. Now, you say, well, why is choice E wrong? Because clearly this dude is an alcoholic. You know, he's probably had instances of this in the past. I could have made it more difficult had I told you he's had 3 episodes of acute pancreatitis in the past. You'd be like, oh my God, it's chronic. The thing is, there's no pain associated with chronic pancreatitis. I'm gonna make this real clean and easy for you. Ready? I want you to think of chronic pancreatitis as just cirrhosis, but of the pancreas. It's pancreatic burnout. Okay, so there's no pain. There's just decreased enzyme secretion from the pancreas. You have decreased proteases and lipases coming from the pancreas. This will present on USMLE as an alcoholic who has steatorrhea. That's it. If I said 50-year-old dude, alcoholic, and he's got steatorrhea, no other information, answer chronic pancreatitis. No pain, no elevation of enzymes. Okay? And they just want, you're going to replace the pancreatic enzymes. Pancrelipase is an answer in one of the 2CK forms. You're going to replace the pancreatic enzymes for chronic pancreatitis. For acute pancreatitis, 2CK step 3 stuff, they want you to know the triad of NPO, which means nothing by mouth. It can show up on the NBME as bowel rest. So bowel rest, number 1, 2, NG tube, it'll show up as nasogastric decompression. And number 3, just IV saline. So CT scan is what we're going to do for pancreatitis. You have to look for a degree of fluid accumulation within the pancreas. Choice E, wrong fucking answer. You know the deal. I'm just going to make more content. I'm going to subscribe to it. Appreciate your time. That's it.